Hey everyone, welcome back to the channel BAMS Notes Simplified. So in this video we will be discussing about Dhatukshayajanya VATAVYADHI Chikitsa and Margavrodhajanya VATAVYADHI Chikitsa. So in an earlier part of the video I have shared the Dhatukshayajanya Chikitsa, and in the later part there is Margavrodhajanya Chikitsa. So before this I have also uploaded another video in which we have talked about Samanya and Nanatmach types of VATAVYADHI. We have seen the common causes, prodromal symptoms or Purvaroop, and symptoms or the Lakshanas, the Samprapti, and also the common treatment for both types of Vyadhis here. So in this video now we will see the special treatment for both the types of Vyadhis. Now I really hope that you are liking these English audio notes. If you are finding these notes useful, then please like, share and subscribe to this channel. Also soon I'll be uploading these English notes on my website. You can go and check it out there, and you can download and print these notes so that you can revise easily and go for your exams. So I would like to request you to send me some comments or suggestions regarding whether I should keep this channel a common channel for Hindi and English notes, or should I separate the English notes channel. So I would like to know your reviews about this, or what do you think about this. So now let's get into the video. Alright, so like you know that VATAVYADHI is a very vast chapter. So in the earlier video also I said that we won't be able to cover this big topic in just one video or a couple of videos. We will need multiple videos to cover this topic. So I will cover small topics, subtopics in each video, so that it will be easier for you to remember them and revise them also before going for your exams. So now let's get into the VATAVYADHI topic of chikitsa of both the types of VATAVYADHI. So first of all, let's see what is Dhatukshayajanya VATAVYADHI Chikitsa. So there is a shloka here which is a very important shloka. So what is it? Kevalam nirupastambhamadau snehe rupacharet vayum sarpir vasataila machchapanehe naram tatah. So it's quite an important shloka. You get it for MCQ also, and if you are asked to write the chikitsa of this Dhatukshayajanya type, then surely you have to write it, because like I say in my Hindi videos also, that for example if you write science exams, then how it is that if you draw a figure or a chart or something, then surely you get some extra marks, right? So the same way it is here for the shlokas also. If you write a shloka and then describe it further, then surely you are going to get more marks. So try to remember a few important shlokas. Obviously you cannot remember all of them, but a few important ones are to be remembered. Alright, so what is it written here in the shloka? In this type, in the chikitsa of Dhatukshayajanya VATAVYADHI, Snehan chikitsa is very important. So all kinds of Snehan is to be done here for this treatment. So now let's see why Snehan is so important. So for that we'll have to see what is the action of Sneha, or what is the karya of Sneha. So Sneha destroys Vayu. It destroys Vayu. It indirectly acts on Vata. So what happens in Dhatukshaya is there is Rukshata, Kharata and Parushta in the Strotastas, right? So with Snehana what will happen? This Snehana will reduce this Dhatukshaya, Rukshata, Kharata and Parushta, and the site, the affected place will become Snigdha, Shlakshana and Mridu. Now Vayu will also get its Anulom Gati. The natural Gati of the Vayu is Anulom, so it will get its Anulom Gati, and Vayu Sang will be reduced, and Vayu Bhavan diseases will also be, consequently they will also reduce. So all types of Snehan is necessary for the treatment of Dhatukshayajanya VATAVYADHI. So in these types you can do Snehapan, there can be Abhyanga, there can be Shirobasti, Anuvasan Basti. All these types of Snehan procedures are to be done in this type of chikitsa. So for Snehana what can be used? For Snehana, Ghrita, Tela, Vasa, Majja, anything of this can be used. But for Vata, Tela is the best. Tela is the best Sneha. It is the most superior Sneha. So this is the MCQ, that for Vata which kind of Sneha is the most superior one. So Tela is the answer. Now why Tela is so good for chikitsa or for Snehan in VATAVYADHIs? Because it is best Vatagna. It is the best Vatagna or Vatanashak. It is Vyavayi, Ushna, Guru, Snigdha. Also it becomes more Gunadayi or qualitative when sanskar is performed on it. So when we make it siddha, it becomes even more qualitative. So the siddha oil is very much potent when the oil is sanskar happens with vatagna dravyas on the oil, then it becomes multiple times more gunadayi or qualitative. So such an oil is very beneficial even when the vata is located in the sukshma marga, deep inside. Even when it is located in sukshma marga, still such kind of oil can be beneficial for this type of vatavyadhi. So that's why when Snehan has to be done, it can be done with any of the four, Ghrita, Taila, Vasa or Majja, but Taila is considered to be the best for vatavyadhis. Alright, so once Snehapana is done or Snehan is done, then what is to be given? Dugdha, Yusha or mansras of Gramya or Anup birds and animals, or Khichdi with Ghrita. These things are to be given after Snehapan, and then after that Swedan is to be performed. So wherever the Vata Prakop is there, the affected site is there, at that place Baya Snehan is to be done, external application of Snehan is to be done, and after that Swedan is to be done. And the Swedan can be Nadi Swed, Prastar Swed, Sankar Swed, any kind of Swed. The doctor or the Vaidya will decide it accordingly, whichever is needed. Any kind of Swed that site is to be given after Snehapan and this Anna is eaten. Okay, now what are the benefits of this? The Vikruta organs will get back to their normal sthiti. So the organs that are defected, they'll get back to their normal condition. The Shushka Dhatu will get Poshana. There will be nutrition provided to the Shushka Dhatu, and the Dhatu will get Sanhanan. Also, the Bal, Agni and Prana and the total Dharana Shakti of the body will be increased, or Vardhan will happen of Bal, Agni, Prana and total Dharana Shakti. So there will be Bala Vardhan, Agni Vardhan, Prana Vardhan and Dharana Shakti Vardhan of the body. So these are the benefits when Snehapan, and after that this Swedan is done. Alright, so Snehan is a recommended line of treatment for this type of Vatavyadhi, the Dhatukshayajanya Vatavyadhi, but Anuvasan Basti is the most superior treatment for this. So Anuvasan Basti is a Snehik Basti, right? So Snehan is recommended treatment, so naturally Anuvasan Basti is the best one for this treatment. And for the Anuvasan Basti, the Sneha or the Taila that has to be used, they are Bala Taila, Narayan Taila, or any Balya Aushadhi Siddha Taila can be used. Sneha is to be used, Anuvasan Basti is there, so Sneha use has to be there. So what kind of Sneha? Bala Taila, Narayan Taila and Balya Aushadhi Siddha Taila can be used. Now other than this, Madhu Tailik Basti can be given, Rajayapan Basti, Dugdha Basti and Mansras Basti also can be given. So the Aushadhis or the medicines that are used to treat Dhatukshayajanya Vatavyadhi, they should be Madhur and Amla Rasatmak. They should be of Madhur and Amla Ras. They should be Madhur Vipaki, Shita Viryatmak and Guru and Balya by nature. So in the earlier video also we have seen that for Dhatukshayajanya Vatavyadhi chikitsa, the drugs should be Madhur Amla Rasatmak, Madhur Vipaki, Shita Viryatmak and Guru and Balya by nature. Also the dravyas that are used for the treatment of this type of Vatavyadhi are Bala, Ashwagandha, Shatavari, Masha and Kushmanda. So these are the Vanaspati dravya that are used. Now let's see what other kind of medicines and kalpas are used for the treatment of Dhatukshayajanya Vatavyadhi. So after Vanaspati dravya, there are some Khanij dravya bhasmas that can be used for the treatment of Dhatukshayajanya Vatavyadhi. They are Abhrak, Loha, Vanga, Raupya and Swarna bhasmas. Also Mansras and Vasa of different animals also can be used for the treatment. And some of the kalpas that are used are Bala Pottali, Bala Taila, Shatapaki Kshir Bala Taila, Chandan Bala Lakshadi Taila, Ashwagandha Valeha, Ashwagandha Ghrita, Ashwagandha Rishta, Mahamash Taila, Mahamash Modak, Narayan Taila, Shatavari Kalpa, Kushmanda Valeha, Kushmanda Pak, Mahayogaraj Gugulu, Hema Garbha and Vasanta Kusumakar. So to remember this list, you can see that two products are, or the two kalpas are made up of Bala, and Ashwagandha also 3 kalpas are there, Mahamash 2 are there, Kushmanda are there. So these are a few important ones. So to remember, it will be easy for you if you group them in some kind of mnemonics like Bala Pottali, Balatel together, Ashwagandha Valeha, Ashwagandha Ghrita, Ashwagandha Rishta together, like that. So a few of these kalpas you can write down when they ask you the treatment for Dhatukshayajanya Vatavyadhi. Of course you cannot remember and write down all of them, but some of the important ones if you remember and write down, it will be good. Alright, so with these medicines or dravyas and kalpas, what Anupana has to be given? Anupana is something which is given with the medicines. So these medicines or dravyas or kalpas are to be given with dugdha or ghrita sharkara, what we call as ghee chini. So dugdha or ghrita sharkara is to be used. Like we see that sneha is important, so ghrita is included here. Now what is the patya that is to be followed, the do's and don'ts of eating and activities. So for ahara, the person has to take snigdha ahar, paushtik ahar means nutritious. Different snehas to be used in good quantities. So different types of snehas, ghee, oil, everything is to be used in good quantities in his meal. The dravya should be madhur amla and lavand rasayukta. So madhur amla and lavand rasatmak dravya should be used in eating. There should be dugdha and mansa also included in the food. Now about vihara. So the person should be doing sukhashilata and not doing any worries or not doing too much of chinta. Also all the upachar which is mentioned in the Hemanta Ritu Paricharya, in that except for the Stri Samparka, everything else has to be followed for the vihara part of Patya. So an important MCQ for Anupana can come here, that what kind of Anupana is used for medicines which are given in Dhatukshayajanya VATAVYADHI. So you have to tick mark, either there will be dugdha or there will be ghrita sharkara. So any one of these you have to tick there. Alright, so now let's see what is the chikitsa for Margavrodhajanya or Upastambhit VATAVYADHI. So there is an avrodh, right? So whatever the chikitsa is to be done, it should be reducing the avrodha. So it is expected that the chikitsa should be reducing the avrodha. The avrodh is caused mainly due to what we have seen, that it is caused mainly due to kapha or ama. So the medicines that reduce rodh should be used. So the ones that will clear this kapha or ama, they have to be used. So the aushadhis that are used, or the medicines, they should be dipan, pachan, ruksha, anabhishandi, ushnavirya, lekhana, katu tikta rasatmaka, katu vipaki, mrudu anuloman also should be there, it is very important. And niroha basti can be given. Anuvasan basti is not to be given, niroha basti is given. And gukula kalpas are very important, but only for this upastambhit vad. Gukula kalpas are not used in the nirupastambhit type. Also snehan is used there, but not in this Margavrodhajanya type. Anuvasan basti is also used there in the Dhatukshayajanya, but Margavrodhajanya we use niruha basti. So the aushadhis should be dipan, pachan, ruksha, anabhishandi, ushnavirya, lekhana, katu tikta rasatmak and katu vipaki. Also the aushadhis should cause mrudu anuloman and niroha basti should be given, and gugul kalpas are very important, but only in this upastambhit type of VATAVYADHI. Alright, so what dravyas and kalpas are to be used for the treatment of Margavrodhajanya VATAVYADHI? So the dravyas that are to be used, they are rasna, dashmul, guduchi, devdar, erandmul, lasun, hing, bhalatak, karaskar, vatsanab, trifala and trikatu. And the kalpas that are used are Yograj Gugul, Kaishor Gugul, Amruta Gugul, Rasna Gugul, Snehanad Gugul, Rasnadi Kada, Maharasnadi Kada, Dashmul Kada, Dashmul Arishta, Bhalatakasav, Bhalatak Parpati, Devdar Vyadi Kada, Gandharva Haritaki, Lashanadi Vati, Hingvashtak Churna, Vat Vidvans, Ekangvir, Ampachakvati. So you can see in the kalpas, most of them they are of Gugul, and others are Dashmul, Dashmul Arishta. All these are easy to remember, these are not so very difficult ones. Also you need not remember each and every one of them. Like I said, that if they ask you the chikitsa for both the types, then a few of them, maybe 5 of each you can mention. And if they ask for just a particular type, just for Margavrodhajanya, then a little more quantity of number of kalpas you will have to write. Alright, so what is Vajja or not to be done in Margavrodhajanya VATAVYADHI Chikitsa is that Snehan is completely Vajja, Snehan is not to be done, and Svedan only Ruksha Sved is allowed. So in Dhatukshayajanya we saw that Snehan is very important, and in this type Snehan is completely Vajja, it's totally contraindicated, so it is not to be done. When the pain is extreme, there is lot of pain at the side, then there is some external application of Vishagarbha Taila can be done. So other than that, no other Sneha can be used or is to be used in the treatment of this type. Now what is the Anupan which is to be given with the dravyas or kalpas of this chikitsa? So honey or warm water, madhu and or warm water is to be given. So there is an MCQ on this, that honey and warm water, or honey or warm water, is Anupan for which type of Vatavyadhi chikitsa. So you will have to write there Margavrodhajanya. If you remember, in the Dhatukshayajanya it was Dugdha and ghee sharkara, ghrita sharkara. So here it is honey and warm water. Now what kind of ahar is to be given to the patient? The ahar should be laghu, drava, ushna and deepan pachan. We have to cure the Margavrodh here, right? So the ahar should be laghu, drava, ushna and deepan pachan. Also yush made with which is siddha with lasun, hing, ardraka. This yush is to be included in the diet. Especially kulatha yush is very important in ahar of Margavrodh Vatavyadhi chikitsa. The vihara should be according to the bal of the patient. Yathashakti vyayam and activities, any exercises which the patient can perform easily, can be done. So there are no restrictions as such what is to be done or what not, but it should be according to the bal of the patient. Now the whatever is given here, or what we have discussed in this video, is a samanya chikitsa. It is a common treatment. Now the treatment or the chikitsa, it differs according to the sthana sanshraya. So where the vyadhi is taking place, according to that the chikitsa will differ. Also according to the dushya, the chikitsa will differ. And also the prakupit vata prakara, which vata is actually prakupit, according to that type also the chikitsa will differ. So this is just a common guideline of the Vatavyadhi chikitsa, but it will vary very much according to the person and according to where the vyadhi is taking place, what is the dushya and what is the prakupit dosha. So the doctor or the Vaidya has to decide accordingly. Now general guideline is that for the Udan Vayu Prakop there has to be an Urdhva chikitsa. For Apan there should be Anuloman chikitsa. For Saman Vayu Prakop there should be Shamanopachar. For Vyan Vayu Prakop there should be Vaman, Anuloman, Shaman, everything. And for Pran, first we have to protect Prana. Whatever else comes later, but first Pran protection has to be done. Even if other Vayus you need to ignore. Even if you need to ignore the other Vayus, you still have to protect Prana anyhow. So for Udana there should be Urdhva chikitsa, for Apana there should be Anuloman chikitsa, for Samana Shamanopachar, for Vyan, Vaman, Anuloman, Shaman, everything, and for Pran has to be protected at all costs. So this is a general guideline for both these types of chikitsa, for Dhatukshayajanya Vatavyadhi and Margavrodhajanya Vatavyadhi. But for individual Vatavyadhi, the chikitsa will differ a little bit according to the sthana and the dushya and the prakupit vata. So if you are asked for LAQ, then both these types you have to include. So in this video we saw what is a common treatment for both these types of Vatavyadhis. Now in the next video we will see what is Vatavyadhi according to modern science, and different types of vatas like Koshtagat Vat, Amashayagat Vat, Pakvashayagat Vat, Gudagat, Twakagat, Raktagat, Maunsagat, Asthimajjagat Vat, Shukragat, Siragat Vat and Snayugat Vat, and their treatments also. So I have tried to make this topic simple by making these short and concise notes. I hope you find these notes useful. If you do, then please like, share and subscribe to this channel. Also these notes will be soon available on my website, so you can download and print them, and then you can revise them easily before going for your exams. So if you like these English audio notes, then please like, share and subscribe to this channel, and please let me know in the comment sections below if you want notes on any particular topic. I will try to make notes on that topic as soon as possible. Also please let me know if it is okay that I include these English notes in this Hindi channel only, or you want a separate channel for the English notes. So your comments would be very valuable to me, and I will be able to decide accordingly. So I hope these notes make some difference to your studies pattern, and if it does, then I'm so grateful to it. So I'll see you soon with my next video. Until then, bye bye and take care.